If you're taking a GLP-1 medication like Wegovy or Zepbound for weight loss, here's something people don't talk about enough. When should you actually increase your dose, and when should you not? Hi, I'm Dr. Mickey from the Health and Wellness team here at Ubie Health. As the AI face of Ubie's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're talking about GLP-1 medications, those powerful tools for weight loss that have been making headlines lately. Yes, they can be incredibly effective. But just because a drug works doesn't mean you should rush to the highest dose possible. In fact, doing so can actually make things worse. Patients often ask, Dr. Mickey, if I'm not losing weight fast enough, should I just increase my dose? But that's not always the right approach. Let me explain why. In clinical trials like the STEP and SURMOUNT studies, GLP-1 doses were increased on a set schedule, regardless of how people were feeling or losing weight. But in real-world practice, doctors consider more nuanced factors like side effects, rate of weight loss, even how hungry you're feeling. One of my hypothetical patients, we'll call her Amanda, was excited to start a GLP-1 med. She dropped 5 pounds in 2 weeks, but also felt nauseous all day. Increasing her dose would have exaggerated those side effects and possibly made her quit entirely. Instead, her doctor had her stay at the current dose a bit longer, and not only did the nausea subside, her weight loss stayed steady and, more importantly, manageable. So how do you know when it's the right time to increase your dose? First, assess side effects. Doctors often use a simple 0 to 5 scale, with 0 being no side effects and 5 being severe symptoms like vomiting or intense nausea. If you're at a level 3 or higher, now's not the time to go up. Always prioritize tolerability. No judgment. Your body is adjusting, and slower often means safer. Next, consider weight loss rate. A healthy, sustainable range is around 0.5% to 1% of your total body weight per week. If you're 200 pounds, that's about 1 to 2 pounds per week. Rapid weight loss beyond that, especially more than 2% per week, can lead to gallstone development and even muscle loss. Slower weight loss might be boring, but it's much safer and longer lasting. And let's talk about hunger. If you're within that healthy weight loss range, but feeling ravenous all day, that could mean your current dose isn't quite enough for long-term success. A dose bump might be helpful here, but again, only if you're not battling strong side effects. Also, personal preference matters. Some people feel great at a lower dose and want to stay there. Others prefer to be more aggressive as long as they tolerate it well. There's no one-size-fits-all approach. And then there's cost. Let's face it, GLP-1s aren't cheap. If you're paying out of pocket, it might make sense to maximize the effect at the current dose before jumping to a more expensive one. Every decision should factor in how the medication fits your lifestyle and budget. What about home remedies or lifestyle changes? They still matter so much. Staying hydrated can help mitigate nausea. Eating smaller, more frequent meals can reduce digestive discomfort. And incorporating some light strength training a few times a week? That can counteract muscle loss and even help you preserve your metabolism. Look, GLP-1s aren't magic. They're powerful tools, but like any tool, it's all about how you use them. Go slow. Listen to your body. Talk to a doctor who understands this landscape deeply. Worried about your own health? Start by checking in with a Ubie symptom checker at ubiehealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. Like and follow for more doctor-approved info you can trust from Ubie Health.